Health Tech. So welcome everybody to the 4th edition of Health Tech, presented to you by the Bengal Chamber and Medica Super Specialty Hospital. We have PwC as our knowledge partner, and this program is also presented in association with Woodlands Hospital. So we have with us in the curtain raiser session, Dr. Alok Roy, past president of the Bengal Chamber of Commerce and Industry and chairman Medica Group of Hospitals, Mr. Devi Mukherjee, president of the Bengal Chamber of Commerce and Industry and managing director, Synergist Energy Private Limited. We are expecting Professor Randeep Guleria, director of AIIMS, depending on his schedule. He has another meeting. Honorary Brigadier Dr. Arvind Lal Padmashri, executive chairman, Dr. Lal Pathlabs Limited. Ms. Anna Roy, advisor, DM and A Niti Aayog. Dr. Rupali Basu, Director and CEO, Woodlands Multi-Speciality Hospital Limited. Mr. Arnab Basu, Chairperson, IT Committee of the Bengal Chamber of Commerce and Industry and Managing Partner, East Advisory Leader, PricewaterhouseCoopers Private Limited. Dr. Robin Chakraborty, Chairperson of Health Committee of the Bengal Chamber of Commerce and Industry and Senior Vice Chairman, Cardiology Services and Senior Consultant, Interventional Cardiologist, Medica Super Specialty Hospital. With this, I would request Dr. Alok Roy, past President of the Bengal Chamber and the Chairman of Medica Group of Hospitals, to please deliver his opening remarks and take forward the session.
Thank you, Angana. It's a great pleasure to be here with all of you today on the 4th edition of Health Tech Conference, which has been an annual feature, which we organize along with Bengal Chamber. The purpose and intent of is to get all the stakeholders in healthcare delivery together and discuss what has been happening around in technology, and so update all of us, because we are all caught up in our lives. And we have seen that sometimes the technology slips by. And so just to update all of us, and it's the best example we have seen last year in pandemic. In pandemic, we have realized that technology was our biggest help and biggest savior. Technology came forward to help us in various ways, especially where the infectious rate was so high, R0 was going to 2 and 3. There, the technology became a driving factor in diagnosis. Technology became a driving factor in referrals. Technology became a driving factor in consultation. Telemedicine in last 1 year has been used mostly. The amount of telemedicine technology has been used in last 1 year has not been used for consultation in last 20 years. So that was the volume and proportion where people use technology for coming together and mitigating the disease and providing the relief for the people. Also, the technology was extremely useful in referral consultation, in sending the reports home, in people accessing their reports, the way report was shared across various platforms. So it got clearly established that if we use technology properly, we could help in reducing the time frame in which knowledge gets exchanged, and also save people from getting infected. I think we couldn't have had a more appropriate time to have this 4th edition of Health Technology Conference. And I think I'm glad that we have some of the pioneers in healthcare participating. Dr. Lal, who's the head of Arvind Lal Lab. We have Dr. Guleria. Hopefully he joins us. He had confirmed to join, but last moment, because of the vaccination and all that, a lot of government discussions going on. Hopefully he would be able to join us after Dr. Lal. And we have Dr. Robin and various other senior professionals in healthcare and technology who will be participating in next 2 days. So look forward to have a very, very good interactions for 2 days, and let there be learnings which we'll all take home. With this, I would invite Mr. Dev Mukherjee, the president of Bengal Chamber of Commerce and Industry, to address this conference. Dev, over to you.
Thank you very much. Thank you very much, Dr. Roy, and a very good afternoon to all of you. I join Dr. Alok Roy in extending a very warm welcome to all the distinguished speakers and a distinguished audience who have joined online to the 4th edition of Health Tech of the Bengal Chamber of Commerce and Industry. This, as Dr. Roy mentioned, is the 4th edition of the Health Tech Conference of the Chamber, along with Medica Group of Hospitals. And I remember going back in time, the passion and the commitment with which Dr. Roy initiated this Health Tech Conference, which I think has picked up significant traction over the last 4 years and has delivered considerable value to all stakeholders in the healthcare space. Health tech, ladies and gentlemen, I think we all need to view in an extended space, so to speak. This extended space where we see the convergence of technology with health, healthcare, lifestyle, and overall well-being of people. It is in this perspective, or in an extended space, that health tech is also the interconnection of health systems computation technologies, smart devices based on IoT, IoT-driven sensors, the internet, the power of the internet, the World Wide Web, the computation analysis techniques, or what in the trade is called data science, use of artificial intelligence, machine learning, and other tools that help in actually making predictions, accurate, precise predictions, and also the communication media, which brings all this together to manage illnesses, to manage health risks, promote good health, and as I said a short while ago, the overall well-being of the people. Technology and innovation, both in terms of adoption and delivery, in a very focused and in a very precise manner, is what technology brings to the table. And that's where technology adds value to healthcare. The challenge, however, remains in accessibility and affordability of healthcare to every strata of the society, and that too for all 3 levels of care, whether it's primary, secondary, or tertiary. And that is where I think we all, as responsible leaders, both from the chamber and from the medical fraternity, along with our technology partners, need to rise up to the challenge and make this aspiration a reality. And I repeat, ladies and gentlemen, it's about accessibility and affordability to deliver healthcare to every strata of the society. We all know, ladies and gentlemen, that in the context of the current COVID pandemic, the global spending in healthcare has been significant, especially by the equity players, the venture capitalists, and I understand in excess of $80 billion have been spent in the healthcare industry. There have been numerous mergers and acquisitions in terms of technology deployment, adoption and deployment, large number of partnerships, and all these activities are gaining significant traction. In the Indian context, you would all agree that on all 3 fronts, whether it is on technology, whether it is on skills and on scale, we do have a very significant role to play. And the vaccine rollout has also shown that we can play a leadership role. As Dr. Roy rightly mentioned, telemedicine as an effective medium of delivery in the healthcare value chain has proven its worth during these 10 to 12 months of COVID pandemic. Advanced technologies like 3D printing, robotics, wearables, and other smart devices, various digital tools, they are all helping in bringing technology and making delivery of healthcare, as I mentioned, more precise, more accurate, more focused, and more timely. But yes, indeed, there are challenges, but challenges throw up opportunities. And we from the Chamber of Commerce, along with the medical fraternity, our partners from technology business, along with policymakers, we all need to be not just responsible, but responsive to the needs and play a very proactive role going forward. I'm sure we will all benefit from the deliberations over the next 2 days. And from my side and on behalf of Bengal Chamber, I wish every success to this conference. Thank you very much.
Thank you, Dev. It's very kind of you to have addressed the gathering. I would now, I think Professor Guleria is yet to join us. So as soon as he joins, we will include him along the course of the day. May I request Brigadier Dr. Arvind Lal to give his theme address on digital healthcare, vision and reality, global and pan-India perspective. Brigadier Lal.
Thank you very much. First of all, I would like to thank the Bengal Chambers of Commerce and especially Mr. Dev Mukherjee and Ms. Angana Guha Roy, Dr. Alok Roy, Dr. Robin Chatterjee, Dr. Guleria whenever he joins us, Ms. Anna Roy and Dr. Rupali Basu. So ladies and gentlemen, wishing you a very good afternoon and thank you for inviting me here. In the 1980s, the digital revolution began with the computer and the internet, which further led to proliferation of mobile devices, social networking, big data, and computing clouds. As digital technology becomes ubiquitous and accessible to a wider population, it is having a profound impact on the society, industry, and businesses. Despite dramatic improvement in global health over the last few decades, the current model of healthcare delivery is being rendered unsustainable due to the rapidly rising population and greater concerns over restricted public health spending. This holds absolutely true for the Indian healthcare as well. Therefore, maintaining the status quo is not an option. To deliver continued improvements to the world's healthcare will need to be transformed, with digital playing a vital role, which has also been further highlighted by the COVID-19 pandemic, as Anup just told you. So some of the key trends in health include the expansion of remote care solutions like telehealth, adoption of big data, predictive medicine, and artificial intelligence, AI, exponential rise in mobile health adoption, which has tripled over the last 5 years, the use of IoT, Internet of Things, as Mr. Mukherjee had just mentioned to you, an increase of variables such as heart monitors, exercise trackers, etc., and they have quadrupled between 2014 and 2018. Growing investment in blockchain and improved electronic health records. However, telemedicine and artificial intelligence-enabled medical devices and blockchain electronic health records are just a few solid examples of digital transformation in healthcare, which are completely reshaping how healthcare is delivered. So let's talk about digital technology and healthcare now. In presence of stalwarts from the healthcare sector as well as IT sector in this important conclave today, let us take this opportunity to state a simple but concrete vision for digital transformation of healthcare. According to me, the vision should be to enable access to affordable and quality healthcare for all through digital solutions that are cost-effective, people-centric, and scalable. India has already embarked on the journey to make digital technology the backbone for a transformed health system with the National Digital Health Mission, or NDHM. Key components of the mission include a health ID, telemedicine, health records, health registry, along with DigiDoctor and e-pharmacy services. India has a very fragmented healthcare providers market consisting of public health facilities, private single doctor clinics, nursing homes, corporate hospitals, and non-profit ones also, with varying adoption rates of digitization and no mechanism for portability of records. This has been a deterrent in the adoption of standardized electronic health records, or EHR, for individual patients. NDH set to change this with unique health IDs being created for all citizens. Adoption of electronic health records will lead to an increase in the quality of care while decreasing costs of healthcare services. Let's talk about the digital health and primary care now. In my view, above all, digital health has a very special role to play in filling the primary care void. This exists in India beyond its tier 2 cities, especially in rural India, where about 70% of our population lives. More than 60% of these people lack access to reliable healthcare, which drives them to seek care from unqualified persons posing as healthcare professionals or travel to far-off cities where healthcare is available. Consequently, on account of catastrophic health expenditures, 55 million people below the poverty line every year. With advancements in digital health, we can bring healthcare closer to where people live, which is otherwise not possible because of limited physical infrastructure and human resources. I am again emphasizing that digital health will be of utmost importance for preventive and promotive health, diagnostic testing, telepathology, teleconsultations, monitoring quality of care, as well as tracking supplies and utilization of drugs, diagnostics, and vaccines. I'm happy to share with you that through our philanthropic endeavor, which is Arvind Lal Vandana Lal Foundation, the ALVL Foundation, I and my wife, Dr. Vandana Lal, are partnering with the government of Uttarakhand to equip and run 10 health and wellness centers, HWCs, under Ayushman Bharat program as Smart HWCs to deliver primary care in rural areas of Almora district, Uttarakhand. These Smart HWCs are being digitally enabled to provide essential services like diagnostics, teleconsultations, health IDs, and electronic health records, community-led health and wellness interventions, etc. The 10 Smart HWCs will act as demonstration models for replication across the country. Another NGO that we support is Village Ways Charitable Trust that delivers subsidized healthcare in remote areas in upper reaches of Uttarakhand again through community engagement and telemedicine at a network of small private clinics. This rural health model has been adopted from your own West Bengal-based Dr. Shweta Saha, an England-returned general surgeon. The model integrates the 3 T's: treatment, training, and technology using a clinical algorithm-based primary healthcare software. So let's talk about the digitization and lab practice. To make you all believe in the transformative power of digital health, let me share with you that my journey of digitizing the lab practice started way back in 1986. I introduced in India the first computerized dedicated lab information management system, or LIMS, and Dr. Gurdial Singh, then recently returned software engineer from USA and Kharagpur, wrote the program in basic language, and the entire program took a space of 20 kilobytes. That was too much for me in those days, with which we were able to fully computerize our lab's operations. This was a pivotal moment in diagnostics in India. Then in 1999, we installed the world's most prestigious Triple G LIMS, known as Ultra, for the first time in India. It gave us a true bidirectional interface, provided connectivity between collection centers, and became the backbone of future connectivity between other labs and hospital labs. Though the software was in Unix, excuse me, a language which was not very user-friendly, and the database was in Unified 2000, its sturdiness was truly amazing. So now let me explain to you what we brought to the country at that time. So on the left-hand side, we have this lab in Tripura, which is a public-private partnership for a long time. And the bar-coded Vacutainer containing the patient's serum gets or hits the biochemistry analyzer. And the barcode is read, in which the ID of the patient is mentioned. It is transmitted to our server in Delhi, which is 2,800 kilometers away, via the INSAT 3C. And the server in Delhi, after having received the lab number, has already been updated at the time of registration of the patient, namely with his name, number, etc. But the most importantly, the test order. The test order is sent back to the analyzer in Tripura via the INSAT 3C, and each jump or each cycle takes 8 milliseconds. And gentlemen, we brought this into the world for the first time in 1999. It was not Tripura at that time, it was Kanpur. So today, the backbone of our business is the IT platform, a complete revamp of which was carried out in 2012 when we commissioned an IBM-designed and IBM-operated data center at our Rohini reference lab. We were the first diagnostic lab in India to install a very sophisticated LIMS called Star LIMS 10.5 version from Abbott. 2014 onwards, we kept increasing our digital health adoption pace to serve the consumers in the best possible manner. This includes developing the mobile applications for customers to register and schedule sample collection. The same app is also used by on-field phlebotomists. A chatbot on our website to answer all report-related queries is there. An EMRF, which is Material Requisition Form Portal project, was implemented to overcome issues of material management. Deploying equipment like the Philips ultra-fast scanner to digitize our histopathology samples and obtain high-quality clinical diagnostic images, hundreds of kilometers or thousands of kilometers away. By the way, the #1 histopathology testing lab in the world, and we test more than 1,250 biopsies every day. Then totally automating the lab process, where lab instruments are integrated with LIMS that tracks specimens and workflows, aggregates data, and ensures lab operations are compliant with various standards and regulations amongst several other initiatives. And I would say that this is a continuous process. About the public-private collaboration. In India, we have witnessed that the private healthcare sector has a large acceptance and appetite for adoption of disruptive, innovative products and processes. Therefore, it is imperative for the government to partner with the private sector to draw from their learnings and implement digital health in India. Earlier this week, I was a part of a webinar organized by Ministry of Health and Family Welfare, where the Prime Minister himself addressed us and said that the center was looking at the public-private partnership model to upgrade India's healthcare infrastructure. He mentioned it specifically in context of the National Digital Health Mission, maintaining digital health records of citizens and other cutting-edge technologies and creation of public health laboratories. While technological development moves quickly, the same is not always true of public policy. We should not let this happen to digital transformation of health system, especially at this time when there is a political will and commitment from the Prime Minister himself. Let's talk about the key challenges. Although healthcare, health has the potential to be changed profoundly by digital technology, and this is now a national priority, the challenges faced by healthcare consumers, health professionals, providers, industry, and the government cannot be underestimated. Through the deliberations of this two-day conclave, I hope the experts can come up with strategies to overcome the 5 key challenges to go truly digital. And the first challenge, in my opinion, ladies and gentlemen, is the last mile connectivity. Unavailability of affordable high-speed communications services, the digital divide, as I would call it, is one of the greatest challenges for implementing digital health solutions in rural areas and many others too. And by the way, what I showed you, the the satellite model is a costly model. While the government's BharatNet project aimed at connecting 2.5 lakh gram panchayats has made 1.5 lakh gram panchayats at the headquarter level, this connection needs to be extended up to health facilities in the villages. New advances like Elon Musk's project Starlink are worth keeping an eye on. Starlink aims to provide internet connectivity across the world via a network of 12,000 private satellites orbiting overhead. It has already launched more than 1,000 satellites and announced to provide a speed of up to 300 Mbps. I'm not sure whether hundreds of these satellites were launched from our INSAT rockets, ISRO rockets. In absence of reliable internet connectivity, the digital health agenda cannot be realized in rural India. You can say goodbye to it. Cultural barriers in the adoption of digital health. Due to a disconnect between tech developers and the customers, both healthcare professionals and patients, adoption of digital health solutions has been rather slow. Along with making healthcare professionals a part of the product development, developing their digital skills is critical to successful adoption in practice. Similarly, for patients, creating awareness about digitally managing their health is crucial. But how do we do this effectively? Let's talk about giving some incentives to healthcare providers. Migrating from analog to digital health is an expensive affair. Though it reaps cost benefits over the mid to long term, the upfront cost is high and even unaffordable by many healthcare providers. As Indian healthcare is dominated by usually single doctor clinics and small standalone doctor-owned hospitals and nursing homes, substantial incentives have to be offered to provide providers to help them switch to digital health solutions. Then let's talk about the personal data protection. Absence of a legal framework for data protection in India has increased the risks related to digitization. The pending draft Personal Data Protection Bill considers health data as sensitive personal data. For example, no patient would like the world to know that he went for an HIV test, and no lady would like it to be known that she went for a pregnancy test to, say, Roy and Trivedi Labs. Even though new technologies and government initiatives to improve cybersecurity are underway, there is no mechanism to protect consumers as well as healthcare providers in case of any accidental breach or criminal attacks, as we faced one recently. And the last challenge, in my opinion, is the interoperability and overcoming the silo effect. Lack of interoperability continues to be a stumbling block in the development of digitally enabled ecosystem. The transformation cannot happen merely by each one of us adopting digital technologies. Unless the data and records we generate can be exaggerated, can be created, exchanged, patient-centric healthcare cannot be delivered. So in conclusion, ladies and gentlemen, I would like to emphasize that healthcare industry can no longer afford to be sluggish on uptake of digital health. In collaboration with governments, health tech developers, healthcare providers, IT industries and consumer, we shall turn our vision for digital health into a reality. Thank you very much.
Thank you, Dr. Lal. It was so well spoken about you, and of course, the cost effectiveness and the scalability are two paramount factors. And thank you for elucidating it so well. With this, we move on to our next speaker of the day. May we request Dr. Rupali Basu, Director and CEO of Woodlands Multispecialty Hospital Limited, to address on leadership in healthcare in digital age. Rupali, over to you. Rupali, you are muted.
Mute yourself again.
Rupali's microphone system is needs to be addressed.
She was audible for a moment.
Angana, any information about Professor Guleria?
No, his office has not yet informed us.
Making a lot of sound, I see. Is it making a lot of sound? I think I'll have to join again.
Like to join from your phone?
Is it better now? Can you hear me?
Yes, clear.
It is perfect now. Yeah.
So sorry about that. Okay, so the leadership on when particularly when we are talking about health tech, I thought that it's important to also talk about the leadership which is at the most challenging role in today's age. And what have we done? We have done past 1 year. We have really looked at. We have discovered a new disease. We have looked into how we have to diagnose the disease. What are the things that we need to, created infrastructure, created equipments, HFNOs and ECMOs, and then we actually, invented medicines, and now we are gone into prevention and, vaccination. So we have within this 1 year, I think the leadership at the healthcare organizations at all levels have been really challenged, really pushed us in every way. And we are, I personally think that whatever the fancy things that we talk about, they are not only fancy, but they're all the right things that we are talking about on getting digitized. And we are into that digital world, but we are still not actually in the digital world. It is still like the way we do CWIP, it is DWIP, digital world in progress. So it is still, we have to still do a lot of manual work. So naturally, in this kind of, in progress situation, the leadership which is constantly is been bombarded with, what we are supposed to do. And that's how I think that, that it is important to talk about leadership. And what I think what we have to start with, if we have to really start with two areas. One is that our own individual, area, that what do I do as individual leaders when we are chosen, and one is that external influences on our leadership, how that is impacting our leadership style, leadership work. So the leadership is, I think the start off with is that we have to have a digital mind. In this digital world, unless you have a digital mind, it is very difficult to really take on the leadership. And that's why that's the start point. Once you have a digital mind, I think we need to move on. What is this digital mind all about? It is all about talking, learning about the new things, the knowledge, the innovation, the research orientedness. Unless you have that, knowledge hungry mind, unless you are, you are in the huge knowledge which is out there for all of us, we are really not ready to take on to the world today, be it pandemic year, or we will end the pandemic at some point and get into our normal life, later. So whatever the situation is, I think this research-oriented mind, digital mind, knowledge-seeking mind is very vital. The moment you have that, then you are ready to do the next steps. Next steps is all about, being analytical. in the digital age, everything is there on your dashboards, on your reports, on the people that are working in the healthcare situations. Healthcares are, we all know that there are all service industry, and different kinds of people are there to help you in getting the services through. So you need to be in touch with your people in different ways of connectivity, be it using your WhatsApp messages, or use your emails, or use different kinds of reports, different kinds of communication, video clips, all kinds of things are happening these days to be connected with your team. And it is again has become a world of 24/7. You are actually working 24/7, 365 days. So you are actually connected, and you are analyzing the information that is coming to you all the time. So 24/7, 365 days. So naturally, this analytical mind is very vital. But at the same time, and this will give you the maximum decision making in leadership. The more analysis you do, the more information you have. And if you have a research oriented mind, and then you have the analytical mind, then you kind of do your decision making pretty well. But at the same time, at the healthcare sector, because it is related to people and related to service, we have to be also charismatic. We also be very, very people friendly, and very, very on the job kind of leadership. A leader which can go down to the floor level and be talk to a housekeeping boy easily, and go around in your wards and talk to your nurses, know the names of your staff, and relate to them, the more at the ground level, at the floor level, is very important. So the digital age tells you to be analytical and be behind the computer, but in the healthcare scenario, actually you need to be out on the field. So that combination of analytical knowledge and be on the field is actually gives you a good leader. It has to be a combination of the charisma and your personality, and a combination of your knowledge. I think that's, if you combine the two, the best leadership and best decision making happens 24/7, 365 days. That's what I think is in your own personal area you need to work on. But then your leadership is also being bombarded with a lot of information from outside. Look at the way the private sectors where we belong, or for that matter, public sector where the government, other doctors and in the whole sector is either private or government, and there are in between some more in quasi-government and quasi-private organizations. That is what the whole healthcare sector is all about. And all these areas, there are a lot of influences from outside, and these influences actually hamper your leadership status. Leadership, it challenges your leadership all the time, because you want to do it in a certain way with your knowledge, with your analysis, with your data, with your charisma, but then you are being bombarded with things which are coming from outside, which is not really under your control. And how much we get influenced by that, how much? It's a lot. You get influenced, and those influences actually influences your everything. As a leader, you are supposed to be in touch with your people. You are supposed to deliver the care. You are supposed to be supposed to deliver the financial requirement of the company or the organization that you are working with. So there is a lot of requirement, and those requirements and those the work that you are supposed to do gets hampered, gets influenced by all this. And we know how much they can change. Today we are even looking at that if the entire private sector, the kind of capping of the prices of your products coming in is actually, you don't even know that the investments that you're doing, what you're going to get your revenue out of your investments, because there's so much of influence happening, and so much of things which are external to the work that you do. So we need to be, the leadership has to be naturally then careful of those influences coming towards you. So we need to be very, very open, very again analytical, and take down those inputs from outside, and make sure again a balance, balance of the best of whatever the influences from outside or the knowledge that you get, and you deliver. Your body language, your the way you talk, the languages that you use, the thought process that you have, everything actually counts. Everything counts. So I think that these influences are going to increase more and more, and the science moves beyond all of us. Science will keep moving. There'll be new diseases will come, new inventions will happen, new equipments will come, science will move. Science is dynamic and it will move. So in spite of whoever tells you to do what, your science will keep on moving. So with this scenario, we need to scientific. We are all healthcare sector is a pure scientific sector. So if we are driven by science, so we need to kind of have the scientific mind, scientific way of doing things, and at the same time, your digitization, influences from outside, preparation of your own character, your own charisma, your own leadership is what we need to do. I think it's a lot to ask for the leadership, but at the same time, I will end up saying that we don't have actually ways to create good leaders in our country. I don't think we have in our medical profession, when the medical CEOs they are not taught management at all. We are healthcare management professionals, so I've been trained in different organizations, different universities, as good as a Harvard too. So we are trained and we have been into the field for a long time. So, but then there are, as I see around us, it is still a long way that the healthcare leadership is also being prepared to take these challenges and be successful leaders going ahead. So we need to maybe create a CEO's council, or somewhere where we map maybe we can start with the city and the country, and maybe the several other countries, and then kind of make sure that all the CEOs who run healthcare organizations, or all the healthcare leaders, do think in the same way, do eat in the same way, do things in the same way. And that's how I think certain things are very constant, and certain things we cannot differ. It should continue in the same way. So if we are together in those ways, our companies may be different, our logos may be different, our people may be different, but there are certain things which are very constant, and we must agree to those things, because science doesn't change. 1 + 1 is always 2. So with those words, I think there's a lot of challenge to the healthcare leadership, but at the same time, we have shown how we have taken up the pandemic in such a wonderful way. We have not messed up with care. We have not messed up in diagnosing. We have not messed up in treatment. I think the large responsibility which is given to us, and we will be also vaccinating, and prevention is also on the way. So we will be doing our job well. And I think the biggest example there is the leadership and protocol-based care. We have worked on, from the government of India to the state governments to all the healthcare providers. We have worked together in the same mind that we have to, the common enemy is the COVID-19, and we've moved ahead. And that's how I think we have to move ahead with all our diseases, the 10,000 plus diseases and 4,000 plus activities that we do in our hospitals. With that promise and with that hope, I will conclude my my little talk today. And thank you very much, Bengal Chamber. Thank you, Dev. Thank you, Rovinda. Thank you, Alok. Thank you, Dr. Lal. All of you who are here, Mr. Roy and Dr. Basu, all of you, Amuna, all of you. Thank you very much for having me. Thank you.
Dr. Pali, it was very kind of you. And of course, I agree fully that the way the private stakeholders in healthcare rose to the occasion of pandemic and got together, and along with the government, we defeated the disease to a reasonable extent. And the way government has appreciated 2 days back, where Dr. Lal also referred to, where the Prime Minister addressed all the healthcare stakeholders along with the government officials, and very categorically emphasize the role of a private healthcare provider, is obviously remarkable, especially when we were used to being criticized, where the Prime Minister himself on a national forum is appreciating the role we all have played. So it reestablishes that the healthcare, whether it belongs to the private or belongs to the government, it belongs to the people. At the end of the day, it belongs to the people. And leadership is a challenging issue and a very important issue across the globe, in our country too, especially in the pandemic. So with this, we are very happy to have with us Ms. Anna Roy, Advisor DMNA Niti Aayog, and welcome to this forum, ma'am. This is our fourth forum of Health Tech Conference, which is organized by Bengal Chamber of Commerce and Medica Super Specialty Hospital and all the hospitals of Eastern India. The intent of organizing this conference is that we share whatever is happening in digital health, digital area to the healthcare arena. And your address would be very useful for us to understand the government and your viewpoint in that direction. With this, we invite you to deliver an address on Government of India's vision on digital healthcare. Ms. Anna Roy.
Thank you, Dr. Roy. So I must be the only one who is not a medical doctor on this panel, I think. And I have been heading the Frontier Technology vertical in Niti Aayog for the past 3 years. By training, I'm an economist, so I bring in a whole lot of stuff to the table. So, we are living in this era, what has come to be known as the Industrial Revolution 4.2. Now, what is it? Basically, I would first of all like to refer to the budget, this year's budget, which put the stress on wellness, nutrition and wellness. So that, shows the thinking, the direction in which the government is going. So it is more towards prevention. And through prevention and better health services, better health of the populace. So the shift is now on prevention. And when I talk about Industry 4.0, this bouquet of technology which comes under this fourth industrial revolution is something which really provides us the tech opportunities to move to a space where we not only, have a more strengthened preventive mechanism, but we also, are able to overcome some of the challenges which the country has been facing of access barrier, of lack of resources in the med space. And that's why I would like to, emphasize on this technology and speak a little bit about this technology and highlight the potential of this technology. And then at the end, talk about what Niti Aayog is doing and look for collaborations, because we all collaborate in Niti Aayog with various stakeholders, and private healthcare establishments are one of the areas, one of the stakeholders with whom we work closely. So this technology is typically a cyber physical, which brings digital to our physical world. And here what happens that, you are able to, like the COVID so well, the COVID pandemic showed how despite lockdown, despite social distancing, we were able to achieve a whole lot of stuff. And that is because of the digital advancements in the country. We could all work from home. We moved on over to the telemedicine part. And several things were done digitally, which earlier, though the infrastructure and other resources were available, but the push came because of the pandemic. So that is the potential. And let me tell you, we are just scratching the top. The potential is much more immense than what we see today. Niti Aayog came out with a strategy document on AI, artificial intelligence, which is part of the industrial IR 4.0, along with drones and quantum computing and various other technologies. And artificial intelligence is a means which allows us for kind of, supplementing what the medical profession is also doing. There is always a apprehension whether this will replace humans. Now, in my view, while this is presently a pedantic kind of a debate, and I really am not a future teller, so I don't know what will happen going forward. But while some automated jobs will get, taken over, I still feel this technology will supplement and augment the capacity of the human beings. It will not replace the human beings. That is my personal view. Of course, people may disagree. And I feel that we need to push this, because this technology is something which will help us in meeting our various challenges. What are the enablers for this technology? First, you need to have the data, because data is something which will help you in bringing out the tools, and you need to have the huge compute. So artificial intelligence is not something which is a new technology. It was there in the 60s, 70s, but the recent advancements in storing large amounts of data and advancement in compute infrastructure, which allows us to do a lot of big data analysis, that is what has brought the AI to the forefront. And health sector is one of the main sectors where this can really be a game changer. Besides education, agriculture, several other sectors, financial sector also. This was understood early on, and the national health policy and the national health stack and the national digital health mission subsequently really embarks on this particular philosophy, where you are trying to create this registry of patients, which will help us in developing this database. So, like we have experienced in the digital payment space, what the India Stack did, similarly, we hope going forward, the National Digital Health Mission and the National Health Stack will help us achieve similar, advancements in the health space, because that is the way forward in which we can really leverage this technology. COVID, the way my previous speaker spoke about the COVID vaccination and how we have dealt with COVID. So, COVID vaccination, where, huge amount of in the phase 1, it was given identification, verification of the right set of people. And now we are moving to phase 2, where we are collaborating with the private sector. There also we are leveraging the technology. So all that is possible because of the India Stack, which was developed earlier on. Ours is the country where 1.3 billion have a unique ID. So, with unique ID, with storing documents in the cloud where it can be accessed without going physical, with e-signature, various such technology interventions have allowed us to do all these interventions, and also during the COVID time, be it the Arogya Setu or be it any of the other interventions which helped us manage the pandemic. So I think one of the important issues we need to realize is that understanding the potential that this technology brings in. Niti Aayog comes out with policy papers. We have come out with the strategy document. We have come out with several other papers, but in parallel, we also implement some pilot projects. I would briefly refer to some of these pilot projects, which will, highlight the scope of this technology. Delhi AIIMS, in collaboration with a West Bengal-based startup, has come out with a integrated medical device, which is actually a chair where if a patient sits on the chair within 15 to 20 minutes, around 41 parameters are measured. And those parameters, the data is directly sent to the cloud. And from the cloud, it can be accessed by any remote district hospital or any metro hospital, and can be reviewed by experts. So you do not need to have specialists sitting in a small town or in a remote area. but people in those towns can have access to the expert advice of these experts. So that is one of the very important means of, overcoming the access barrier. We can follow a hub and spoke kind of a model. And, you collect the data. On top of the data, then you are able to also kind of, develop tools which will help you in, prediction in a more automated manner, where you do not need, say, in diabetic retinopathy, you do not need an ophthalmologist, a trained ophthalmologist to sit in a small village. You can just have the scanners where the images are scanned, images are loaded, and the images are studied by the AI tool, and it can be seen by experts. So one phase where access is not there to the specialist, that phase can be overcome by having these automated tools. And it is very important that all stakeholders get together towards developing these tools, which helps complement the work done by our healthcare professionals. So this way we not only overcome the access issues in remote areas, but we also ensure that those people who are really daily wages or who really do not have the luxury of taking leave and going to hospitals, their time is also saved. And we go over to the preventive mode, where early on these diseases are detected, and through a hub and spoke they can be kind of referred. So these are various models we are presently working on. We are working under the guidance of Dr. Vinod Paul. We are coming out with a vision document for health interventions in the technology interventions in the health sector. And there we are looking at all these issues. The other important piece is the data piece. Now, how do you deal with the data? Personalized data, especially in the health sector, privacy is a big concern. So we are looking at various models on how to overcome it. Technology can come to our rescue. We have data sharing, architectures already being proposed, which are consent based. And as we had earlier, argued in our strategy document, that through knowledge sharing will also something which can be dealt with, and in a transparent manner. If we deal with it, the data can be made available, which will really go a long way for our the Atmanirbhar movement, where our startups are given an opportunity to work on it and come out with new tools which can assist our health fraternity. So that is the second part of it. Then we come to the adoption. Now we are in UP's Bharej doing a project on decision support. Presently, what happens that, there is a protocol. So Asha worker, Anganwadi worker go through a list and, kind of fill it up in the register. We are trying to have a technology intervention there, wherein NHS kind of a system, there they have a decision support. So through a tablet, which is preloaded programs are there. The work, the human errors get kind of addressed, and the reliability of the work done by these field level workers becomes more reliable. So that is another pilot project which we are implementing. With the TMC Mumbai, Tata Memorial Center Mumbai, and IIT Bombay, we are working on developing a biobank for cancer, which is expected to be the biggest cancer biobank, and will go a long way in promoting research in this field. So that is another big project which we have embarked on. One of the most latest technologies which is still being validated, I would like to highlight. In our experience, we found that in neonatal care, in many instances, the ASHA worker or the Anganwadi worker will just, routinely note down the height and weight of the infants. To overcome that problem, with the Vadhwani AI Center, a new technology using computer vision and AI is being developed, where by taking a mobile picture of the infant and putting it on the cloud through the AI tool, the height and weight can be assessed, and that technology is being validated. So through all these interventions, these are small interventions, but they can really kind of make our health providers, the services more robust. And we need to work in collaboration. That is the message which I am bringing here. We work closely with Apollo and GSK to develop a properly tried out mechanism of pharmacy, a pharma supply chain using blockchain on ensuring that the right medicines are going, the cold chain is not being breached. So these are several things which we try. And also try to find out what could be the challenges on the ground by doing various pilot projects. What are the governance challenges? But this is not something either the government can do on its own, or the industry can do, or the academia can do on its own. Collaboration is the buzzword here. And I bring this message to this Chamber of Commerce that we need to spread awareness about this, about the frontier technologies. Now there is no difference between a technologist and a domain expert. Today, doctors talk technology. Doctors are aware of technology. In our biobank project, doctors know what they want, so that a wall between a computer scientist and a doctor is really kind of disappearing. They need to work together. And obviously, government, academia, and industry need to come together, because A, development has to be done. B, on the deployment part, government will be the biggest adopter. So with that, I end my intervention and look forward to working with many of you in the times to come. Thank you very much.
Thank you, Mr. Roy. It was a very nice deliberation, and thank you very much for being part of it. With this, Angana, and if we do not have any information about Professor Guleria, then we'll move on with our release of the thought paper.
Yes, sir. Professor Guleria's meeting is still on, so we move on with our release of the thought paper.
Okay, so Mr. Arnab Basu, Chairperson of IT Committee, the Bengal Chamber of Commerce, and he's a managing partner, East Advisory Leader, Rice PwC. And every year he has been associated with us. We have partnered together on the journey of health tech in the Eastern India. So with this, I would request him to release a thought paper on transformation of patient journey in a virtual health care setup in the new normal.
And since it is a virtual program, and every year we do a formal release of this paper, so we would like to have a virtual release in this virtual forum. So I would request the tech team at the chamber to please play the video.
PwC has been the knowledge partner for Health Tech presented by the Bengal Chamber of Commerce and Industry and Medica Super Specialty Hospital. This year as well, they have joined this endeavor, and a thought paper has been authored by them on transformation of the patient journey in a virtual healthcare setup in the new normal. This thought paper is being released formally in today's forum. The link would be available in the Chamber's website, which would be shared with you subsequently.
So over to Mr. Basu. I will share where the link is uploaded in the Chamber's website, but would like to hear from Mr. Basu first.
Thank you. Thank you, Angana, and thank you, Dr. Roy. So it's a pleasure to be part of this initiative every year. And the team has worked on this paper. We do hope that, some ideas would come out which can be adopted. The paper, really this year, we were thinking of, what to focus on, because every year we keep focusing on different items. So this year, I think the paper really aims to identify how the pandemic has disrupted the way healthcare services were being provided, and how, the changes across the patient life cycle, and how healthcare is being provided remotely, how that is changing on a permanent basis. And I think whether it's in terms of, current limitations of supply demand, it helps the country in overcoming that challenge. There's a fair amount of revenue leakage in post-operative care. Also a fair amount of benefit in terms of, saving time for patients. Also the, the response of the providers to the, pandemic brought us many ideas in terms of cost-saving opportunities. So it's not just the time, but also the cost. And remote care, I think many of the, providers here would appreciate that it has been taken with the right spirit, I would say, by the consumers. And most of the consumers we have spoken to in our primary research who have used the remote care facilities which are being provided, they have been pretty happy with it. Technology obviously makes it much easier for them to adopt it. And it's not just about the tier 2, tier 3 cities, even in the metros, we've seen a lot of adoption of that. I think the other one which we heard Anna Roy talk about was around the, the health data. And again, a large part of this patient life cycle and remote care can be offered if we have the right amount of data and, we prioritize the health data amalgamation in the right way in terms of, having the right legislations, having the right level of security, taking the right consent from the patients, so that a single source of truth is there in the ecosystem which can be used. And I think with all these possibilities, the paper also talks about some of the barriers that the industry is currently trying to overcome. And we have tried to categorize these barriers into four domains: the technical difficulties, the behavioral changes which are required, the systemic changes which are more around the legal or the regulatory, and the financial, and how each of these would have to be tackled separately. And also, I think the other thing which we have seen is that if you look at the overall ecosystem, the different stakeholders need to come, very closely work with each other to, make this a reality, whether it is the government or the actual healthcare providers, the digital startup ecosystem, and also the IT vendors. So from our interactions with the, four groups, we do think that the right intent is there and the time is very right now in terms of moving to this. And quite a few of the challenges are being looked in by the, different stakeholders on a real-time basis. We heard some of it today as well. So we are very hopeful that, it would bring in a new way of approaching healthcare in a very supply-demand mismatched environment. And as we move into the new normal, we hope that this will be the way forward. Thank you. Back to you, Dr. Roy.
Thank you, Arnab. Thank you. It was a great effort, Arnab. Like every year, you put up a thought paper, and I'm sure we have enjoyed all your previous thought papers. This one we would enjoy too. And before I request Professor Robin, may I ask Angana if there are any questions from the panelists so we can take up those questions. I know Dr. Lal and Mr. Roy have been waiting there for quite some time. If there are any questions, but I have a question to ask both to Dr. Lal and Mr. Roy. Sir, Dr. Lal, my first question is to you. That you showed that since 2014 you have been working on accessions and report delivery and all that using the using the ISRO satellites and all that. So that was phenomenal. And what you are doing as a ALVL also is phenomenal, that you are spending your trust money in developing the various connectivity. Can you elaborate on these 2 points a little bit more for us to understand?
Certainly, Alok, thank you. And the first question about the using of the INSAT 3C took place as early in year 1999 and 2000. And the simple reason why we needed it was, at that point of time, it was a lab in Kanpur which we had to get connected with us. And the same software, if you remember, we were using at that time an Australian software by the name of Ultra, by a company by the name of Triple G. So even the connectivity by landline was not good, and land telephone lines. In Australia, they had no problem, and that's how they came to us. So we had to use an innovation, and this was INSAT 3C transponder was given to us by a company known as Hughes Escorts. And Hughes is an aviation space company, and Escorts was into telecom at that time. And so they provided us, and it worked very well. And the connectivity was there, I think, more than 90 or 95% time. And it was slightly expensive even at that time. And of course, now once you've got the cables, the optical fiber cable, well, things will change. But as I said, the last mile connectivity, and there's a difference between the slip between the cup and the lift. So that is not yet achieved. The second thing which you were asking me was about how we our initial. It's very simple, Alok. It was majboori, and we had about 80 or 90 patients, per day, and their reports had to be typed. And 2 typists were bang on the typewriter, starting from 12 o'clock in the morning. And my Hanuman Road, many people know, was have been to that lab. People who are slightly old. So the day one, typist would not report for duty, hell would break loose. And we had to write the report of a patient as normal value, his test value. Then below that, we had to write every time blood sugar fasting normal is between 80 to 120 milligram per deciliter, etc. And then we did not know where one sample went, So it solved a lot of problems. But, if you're a pioneer in these kind of things, a lot of equipment, a lot of new tests which we introduced. So the good part is that after that, you get the videos. But at that point of time, you really used to feel that you should run away from here some days, but things were just not happening. So with perseverance and, time factor, IT was accepted very well. I remember when I was a young doctor, the highest export of India, export earning was about 6,000 crores from the diamond industry. Maybe Arnab or they would, like to comment on this and just see where the IT industry has gone now. So I think with passage of time and with the Indian so-called fertile, mathematical mind, which is good at numbers and is logical, or so to say, at least in IT, so has, taken us, many strides forward. Thank you.
Thank you, sir. I still remember that when we started telemedicine first time in 2000, we borrowed the satellite from the ISRO, and it used to be a hell of a job. Number one. Number two, then the government came up with a telephone network which DOT was running, some digital fiber which used to connect. And once in a while, somebody in Bihar will cut it on the roadside, and all our telemedicine will go for a toss. In 2000, we connected with the Tripura Sundari Hospital, an extreme remote corner of Tripura, South Tripura, where we are doing the CCU management. Is to be today, all this can be done on a video WhatsApp. So the technology has really moved. And that is what brings my next question to Ms. Anna Roy, that with this challenge of vaccination, which is looming very large in our country, and that's the only way we can eliminate or at least stop the disease progress at this point of time. And we'd like to hear a little specifically from you, if it is possible for you, to talk about that how the digital role which we are planning for this particular aspect of it.
So the digital role basically is on identification of the beneficiaries, because obviously due to a demand supply mismatch, everybody cannot be administered. So the digital role comes through that mobile app which was used for the phase 1. And now on first the version will be launched for phase 2, and we are looking forward to that launch. So basically what it will do is to, I think, I'm not really qualified, I'm not working in the COVID space, but what I am aware is that it will help in identification and ensuring that, it goes to the right person. Because in a country so diverse like ours, and which is so huge length and breadth, it is really a mind-boggling, exercise to say that, okay, this bucket will get it and this will not. And with all the jugaad in this country, if our technology helps us in achieving the vision which the government has set, I think it is really commendable. Because yesterday I was hearing about US. Somebody was saying about New York that outsiders in New York have got the vaccination, but the residents of New York, have not got it to that extent. So we are not, facing that problem. I think in our case, it is going very systematically. And it is because we have this India stack. We have this unique ID for each individual. Otherwise, how do you track it digitally? So we have the backbone already with us, and which has seen us in so many other sectors. And that is what is, I think, bearing us out in this COVID vaccine thing also.
Well, look, may I have a question? Just a simple question to ask, ma'am.
I would come back to Rupali.
Okay.
I just want to comment on that, then I'll ask you. Okay, you go ahead, Rupali. Go ahead. You are the
small question. I was just, because ma'am is asking about, Miss Anna Roy ma'am is talking about using the, the digital ID, but actually for vaccination, we are not using the Aadhaar card. And I don't know why 130 crore population do have Aadhaar card are not using it. We are using PAN card of people, and there are many people who don't have a PAN card, and we are using voters ID card. Why we are not using Aadhaar card for vaccination registration? It's a huge activity that we are doing at the ground level, and registration of vaccination is not happening with Aadhaar card.
Actually, it is happening both with Aadhaar card and voter card. Both are being used. Somewhere the Aadhaar cards are not functioning, especially the COVID has not taken it. That's a technical question. We can go that.
Technical question. Yeah. Okay.
But
okay.
I think, Ms. Roy, the reason why I was asking this question, the technology is very important, not for us for the ease of operation, also to ensure that operation, whatever is intended for, is done appropriately. One of the biggest criticism of private stakeholders in getting into vaccination plan is that many of our CEOs and hospital heads have given vaccination to the people who don't deserve it or who are not the part of it initially. That has been noted by the government, and government was very reluctant to go ahead, if not properly. That was one of the problem which they had in their mind throughout. And I think a time has come for all our private stakeholders, CEOs, to be very, very ethical and very, very identify with the need of the time, not with the need of your employers or not with the need of your shareholders. This is a time when you need to identify with the country and ensure that what country's priority is your priority. Sometimes those who write our paycheck, we get carried away by them and do favors. And it's known to everybody. Because anybody who's been injected, he has spoken in some forum here and there, and that has been captured, and government knows it fully. Unfortunately, the problem is so huge that we have no option but to go on, and there's no option but to get together and eliminate it by working together. So with this, I think we had a great show. I would request Professor Robin Chakravarti for his concluding remarks.
Thank you, Dr. Roy. I think it was a great session, curtain raiser session of Health Tech 2021. I really enjoyed every speaker's presentation, from our president, Mr. Dev Mukherjee, of course, Dr. Roy. Your conduction of the whole session was great. And Dr. Arvind Lal, you are simply unique, particularly your message about digital doctor, about digital health, particularly talking about preventive and promotive health, was very much pertinent to this particular session. I also would have looked forward to have some highlight about, today we talk about more of a prediction of the disease. So from preventive medicine to curative medicine, we're actually moving towards predictive medicine to corrective medicine. How the digital technology can also talk about predictive medicine and corrective medicine. Your 3T technology was highly commendable for this particular session. I really enjoyed the 5 key challenges that you highlighted in your presentation. And Rupali's presentation, Dr. Rupali Basu's presentation on healthcare leadership was unique, and she had that charisma to take the leadership at ground level, which she proved a number of times, particularly even at the housekeeping level, which is worth remembering. And today, with the digital technology having in hand, you can actually take the leadership of healthcare to at every level of the hospital and every level of the healthcare areas, healthcare space. Mrs. Anna Rai's presentation was unique, particularly about the pilot project and about the integrated medical device was excellent. I really enjoyed when you mentioned about the person sitting on a chair, and then all the data is being captured from there and then being communicated to a far field areas to the doctors and clinicians, and accordingly the therapy or the management plan can be adopted. The only question I have, that today we know that a person can sit on a kiosk, a lot of data can be collected that can be communicated to the clinician, and in return, they can advise. But we do not have any legal permission for those advice. So maybe from the Niti Aayog committee, if some measures can be taken up. I remember my younger days when I used to sort of travel by train. In Howrah station, you stand on a kiosk and you get your weight and your kind of calculated height and weight, and at the same time your fortune. But that did not have any validation. So when you have such kind of data being collected by kiosk and then application, it has to be validated by some nationally recognized body, and that has to be approved by the National Medical Council, so that there cannot be any legal step taken against the clinician or against the diagnostic centers or the hospital against those kind of practice. And that is very important. And finally, Mr. Arnob Basu's presentation is really excellent. And as an IT committee, I really impressed with in a very simple format. Sort of, he talked about the thought paper, particularly the transformation of patient's journey today's in the digital technology space, particularly in relation to healthcare. It is a wonderful session. Thank you, every speaker. And we're looking forward to having you all in the next forthcoming session in Health Tech, and perhaps much more such session from the Health Committee of Bengal Chamber of Commerce and Industry. Thank you very much.
Thank you. Angana, I hope you have shared the link with everybody.
Yes, we will email the link to all registered participants, and we will also post it in all Chambers social media handle in some time.
Okay, over to you.
Yeah. So thank you, everybody. So we conclude the curtain raiser where we stand in digital healthcare of the 4th edition of Health Tech. So we will move on to the next session, which is Trends in Health Tech, which would be chaired by Mr. Arnob Basu. He is there in this session, and where we will have the overview of the thought paper by Mr. Shantan Chatterjee, PwC Consulting Director, and we'll be joined by Dr. Sujoy Kaur, Chief Medical Information Officer and Vice President at Apollo Hospitals, Mr. Klaus F. Nilsson, Global Digital Health and Virtual Care Expert, Mr. Obhik Ghosh, Head Connected Digital Health TCS Research, and Mr. Ayad Al Musa, Middle East Healthcare IT Leader, PwC. So, for our audience in the cloud streaming, we will take a break while you be with us with the Chambers video. And for our audience in the social media, we will come back in 7 to 8 minutes time. Thank you.